Hello and welcome. My name is Armando Nahum. I'm a patient safety advocate and a principal at H2PI, the Healthcare and Patient Partnership Institute. Joining me today is Lieutenant Colonel Stephen Coffey. Hi, Stephen. If you don't mind, would you be so kind to introduce yourself and your role at MedStar Georgetown University Hospital Patient and Family Advisory Council for Quality and Safety?
Hi, thanks Armando. I am, as you said, Lieutenant Colonel Stephen Coffey. I'm an Air Force officer, a patient advocate, and member of the MedStar Georgetown PFACQS for Quality and Safety. So I've been there since 2014.
Thank you, Stephen. When a hospital or healthcare system has an active PFAC, we see them engaging the PFAC in projects that are strategic priorities. The MedStar Health Sepsis Prevention Initiative that you contributed to is a good example of that. What about the other way around? Projects that the council sees as important and brings to the organization? Have you seen this happen?
Absolutely. You know, one of the things that drove me to become a member of the MedStar PFAC was the fact that my son, Stephen, who had a liver transplant at a very tender age of 8 weeks old. He had a transplant due to a metabolic condition called galactosemia. And this condition doesn't allow his body to break down the simple sugar galactose that's found in human and animal milk. So when we were in the hospital, immediately following his transplant, one of his providers said that he needed to have his soy milk calorically dense. And so what that meant was to add some powdered soy milk to his formula so he could gain more weight while in the hospital. And I thought it was just as simple as being able to run down to the big grocery store to pick up a can of soy milk and bring it back to the hospital. But I was told that I couldn't do that thing had to be sent through materials. It had to get through billing. It had to be through management. And it was on a weekend, of course, when all the things that fall apart in the hospital, they always happen on the weekend. And so I realized then that there was a gap in care. And so when we started our PFAC in 2014, one of the first projects we worked on, and we brought this to MedStar Georgetown as an organization, was to look at our dietary. How could we fix that gap that's seen in care where we could provide nutrition to patients? So when you think about how it is that patients are oftentimes able, and the PFACs are oftentimes able to bring issues to the hospital, it's something that requires a listening to our voice. You know, one of the things we've worked on at MedStar Georgetown's PFAC is opioids. I mean, that's an issue that some of our community members who've been impacted by family members and friends that have had opioid concerns and issues, we brought that to the PFAC and said, hey, this is something we need to look at, maybe medication reconciliation, and brought it to our PFAC for MedStar Georgetown to take a look at. The other things, and this is something that's very near and dear to my heart as a minority, you know, I think the world and certainly our country had an awakening with George Floyd, what that happened this summer. And our PFAC saw that we needed to look at diversity and inclusion. We needed to look at some of these unconscious biases that occur. And so we brought that issue of looking at diversity and inclusion to our PFAC to have that as an issue that we raised amongst the hospital. And what was really great about this is that they've taken that and said, you know what, it may not be a physical medical issue or concern, but it is certainly a concern that we need to address and to talk about because it impacts physical medicine and how we deliver care to our patient population. And so one of the things we've done at MedStar Georgetown was to start these hot topics, if you will. And we recently had one where we talked about diversity and inclusion. We look at the COVID crisis that's going on now. This pandemic has a severe impact in mental health. And another one of those topics that we brought to our PFAC, to our leadership, was to say, hey, we need to look at how mental health is impacted because of COVID, not only from the patient perspective, but also from a provider perspective. So I think when organizations and hospitals partner with their PFACs and really value their voice, big changes can happen.
That's absolutely excellent, Stephen. I really enjoy talking to you today, and I can't thank you enough for giving us your time. We know how busy you are, so thank you so much for all of that. We really appreciate it.
No, I really appreciate this opportunity to speak with you guys, and wish you the best.